To the lower regions of the pelvis, right? Where would I find my hollow organs? Where would I find my solid organs?
Hollow organs you gonna find in the
What part of the abdomen?
The lower?
Hollow ones are right here,
Hollow ones are more on the inferior part of the stomach.
and the solid ones are protected by the rib cage.
Exactly. So your solid organs are on the top because they need more protection. They're more vascular, so if they get damaged, they're prone to actually bleeding out. Your hollow organs are not. They have less tissue, so they can't bleed out as much. Keep that in mind from now until forever. Okay? Any questions? All right, trauma assessment and care takes. Nate, if a hollow organ is affected, damaged, how is the pain going to present?
It'll come and go.
Okay. Miguel, why?
Is it from contraction?
Exactly. Okay, physiology of abdominal organs is dependent on individual function. See, pathophysiology of chest, disruption of breathing. Mia, what is one thing that would disrupt breathing? What's something that could disrupt breathing? Give me any example.
Collapse lung.
A collapsed lung from what? Gunshot? All right, give me a medical reason why breathing would be disrupted.
Block airway.
Block airway, okay. Hemorrhagic shock. So if you see hemorrhagic shock, what does that mean specifically, Brian?
They're going into shock and loss of bleeding out.
Loss of blood. Okay. If I have infection that is systemic wide, what is that called? Sepsis. We lead to septic shock. How does septic shock work? How does sepsis make shock happen?
It makes the veins leaky, permeability, make them permeable with all the toxins in the blood.
Permeable and what?
I don't know. High toxins? I don't know.
Vasodilation.
Vasodilation.
Yeah.
Okay. So chest injuries, we kind of covered a few of them yesterday. We went over blunt force trauma, remember? Baseball bat to manual from here. Penetrating trauma, bullet. We covered all this stuff right yesterday. Compression and shearing. This one we didn't talk about. So occurs when severe blunt trauma causes the chest to rapidly compress. Shearing can damage aorta. So shearing, an example when that could happen is during a car accident. So a head-on collision. Let's say that, and if that happens, it's gonna be an older person. Let's say that somebody hit this brick wall, this green brick wall, right? So they went head on because they were bored. This person went forward. How many collisions are in every car accident? It's three collisions. There is the collision between the vehicle and the object. There is the collision between the person and the inside of the car. And there is a collision between the organs and the inside of the body. So during that third collision, when the organs are moving inside of the body, see, this is the heart. The aorta is actually part of the aorta. As it extends down, it attaches to your spine, your vertebrae. So whenever that third collision is occurring, the heart is going forward, and if the patient is older, what happens to the membranes and the tissues? They get weaker and thinner, right? So what can potentially happen is that this can go forward, and because of this motion, it will cause a tear in the aorta between where it connects to the spine and the aorta itself, and that is shearing. Okay, so that is what that is talking about. Any questions about that?
What would be a sign? Would you know that?
They are gonna die pretty fast on you.
Yeah, like, pretty much there ain't no recovery from
Yeah,
that. huh?
they're dying pretty fast on me. They're gonna just plummet, crash.
Much work for us.
Because all the blood is coming straight out of the heart. Like,
What's wrong with you?
I'm realistic.
A lot, right?
Realistic and it's a job.
Rib fractures, painful, but usually not life-threatening, and then even difficult. We talked about this yesterday too. Flail chest, did we ever cover flail chest and paradoxical motion?
I don't think so.
No.
I don't think we covered it in here.
Okay. Flail chest is when you have 2 or more ribs that are broken in 2 or more places. So we'll say that this is your sternum, ribs that extend outward. Okay, so again, flail chest is when you have at least, at minimum, 2 adjacent ribs that are next to each other that are both broken in 2 or more places. So essentially what you have is you have a whole section of the chest that's separated from the rest of the chest itself. That is a flail chest. You have a section that's separated.
And it has to be 2 ribs at least, right?
Minimum 2 ribs, and they have to be broken each in 2 places or more, each of them. Paradoxical motion is what happens as a result of your flail chest. So every time our chest goes outward to breathe in, we create what kind of negative pressure? Negative pressure. Sorry. We're all having a day today. All right. So what happens is that negative pressure that's created from your chest expanding will actually suck that portion of the chest in. So it creates a paradoxical motion, an opposite motion to the rest of the chest. And that's what that is. Go ahead and take it down. I think I showed you guys a video already, but I'll show you guys another one of paradoxical motion.